Okay. This is Angela Piech. I'm the Drexel Liaison to the Graduate Nurse Student Academy, and I'm here talking with Dr. Cornelius today. What is your title?
My title is Professor and Chair of the MSN Advanced Role Department. I'm also the Coordinator of Clinical Informatics Education here at the College of Nursing and Health Professions, and I am an Online Learning Council Fellow for Drexel, the entire university.
Please describe your nursing work and career. How did you get into your current position or research?
I'm going to go down memory lane a bit. Okay, so I started off as, and I think that this is important because I think for nurses who are entering the profession, no matter what level you enter it, there's a lot of opportunity available to you. And you can enter it, as I did, as a diploma nurse, which is I did my training initially at Henry Ford Hospital School of Nursing in Detroit, Michigan. And after that, of course, I went to work at Henry Ford Hospital because they provided a really nice tuition incentive where they forgave your tuition if you worked for them for a number of years afterwards. And the system being enormous and provided a lot of opportunity for a novice nurse to learn about nursing and really have some really great, a wide range of experience. It was a great opportunity. It was a win-win. You know, the hospital benefited by knowing what I came in with because they had hands-on opportunity for training and making sure we had essential competencies. And then I had the opportunity to really learn a lot right in a very enormous teaching hospital. It was a great opportunity for me. And I had experience in working in a heavy med-surg unit, which was providing service to predominantly low socioeconomic status individuals who had limited healthcare resources, so usually came with very complex healthcare needs. And then I also had, after that, working in numerous years there, worked in the emergency room a couple of years, and then worked in the psych department for a couple of years, and then realized that I wanted to do more. So I had the opportunity to go for my RN-BSN. And what the RN-BSN allowed me to do is to leave the hospital and work with the VNA, because you had to have a BSN to move into an independent practice role like the home health care. You don't have the luxury of grabbing somebody in the hall to check the heart sounds that you're seeing, what you're seeing as a patient. You're there by yourself. So you really have to have that higher level education. And following that, I went to work for a specialty home care agency, which was the Michigan Cancer Foundation, which provided home care, specialized home care to cancer patients or individuals with terminal disease. So often people would ask me about that kind of nursing, that, that you're caring for people who are dying. It's like a hospice, but really it wasn't. Pretty much 70% of our patients we discharged to independent care. We provided in-home chemotherapy, comprehensive holistic care for the family, and it ensured that their quality of life, was optimal. So what happened in that role was that I also took on the role of a CNS. And in that role, the clinical nurse specialist, in that role I had the opportunity to provide education and staff development. And I was hooked with the idea of impacting the quality of nursing practice by serving as a role model and educator. That led to a position, a temporary year-long position at Madonna University in Livonia that got me involved in the academic arena. I since then have been working numerous hospitals, numerous healthcare systems and education systems in Detroit, in Pittsburgh, and then in 1997 I came here to the Philadelphia area, where I have been working with what was formerly known as Allegheny University, then transformed into Hahnemann University, and then became a part of Drexel University in 2002. So for the last, let's see, it's 1997, I'm not going to do the math on that, but for a long time I've been here at Drexel University. What that offered me was also another opportunity to grow in my role as a nurse and as an educator, because I was hired as part of the team to work with the public health department, public housing department, excuse University in Philadelphia that to outreach and work collaboratively to improve health outcomes. That really grew into the 11th Street Family Health Center. So I'm very proud of the involvement that I had in working with the community to help empower the community to identify what it was that they needed to improve their quality of life and improve their health outcomes. And that is, I'm no longer involved with that because my role has changed within the university, but I'm very proud that that was a project that has sustained over time and grown tremendously and actually has become a gold standard that other organizations, other even internationally, other countries are striving to achieve. So Dr. Patty Garrity is still at the helm, and she has been doing remarkable things to serve the community and serve as a role model for other parties that are interested in doing similar activities. My role here now is as the chair of the advanced role, MSN Advanced Role Division. As part of that, I'm committed to preparing nurses to assume leadership roles in the in all kinds of arenas. I have 3 tracks that I'm responsible for, but I'm working collaboratively with my colleagues who are chairs of the other graduate programs, the nurse practitioner and the nurse anesthesia. And we have a similar goal, because there's the MSN AACN, MSN Essentials, which recently came out in 2011, that have set the bar very high for what we want the graduate nurse to be able to do when they finish their training. And that is to be able to address population-based healthcare, to serve in leadership roles in transforming healthcare and improving patient outcomes. So that's a heavy responsibility to make sure that the future leaders are prepared to step up because healthcare arena is changing and evolving and so we don't really know what exactly it's going to be. So what we have to do is challenge our students to become, have a skill set to become prepared so that they can be ready to address these changing needs. So right now, in addition to being the chair of the advanced role, my other hat is to ensure that we're using clinical informatics and the meaningful use approaches to preparing our students, our graduates, not only within nursing but in the healthcare professionals area, to be competent users of information, to apply this information to, again, improve patient safety and patient outcomes. And then the other hat, so I'm wearing actually 3 hats, with the online learning fellow, is to ensure, as we start moving more and more into the online learning environment, is to ensure that we're providing optimal learning experience to help build these essential competencies in our graduates. So online learning is different, but you can accomplish the same things in an online learning environment that will really help prepare the students to assume these leadership roles and build their skill sets.
My next question involves a series of mini questions. The larger question is, how would you describe your leadership in the nursing and healthcare field? And the first mini question that kind of is encompassed within that very large question is, what specific issues in nursing and healthcare does it address?
Okay, I have a couple that I'm going to talk about. The first one was the idea of being able to access information at the point of care, at the point of need. That was one of the biggest projects that I was involved in early on at Drexel because, under the leadership of our dean, we knew that technology was very important. And when more and more mobile technology became available, we realized that we needed to prepare our graduates, our undergraduate students as well, to be able to use this mobile technology to support what they're doing, support practice. So I was the lead in our mobile technology initiative. Our students started back in 2000 with using the iPad and other mobile devices with multiple references. We had 6 references that we had put into the mobile device. and then to teach them how to use it effectively. And I'm actually kind of interested in, I laugh a little bit about how reticent people were to have students have these mobile devices in their hands and how they felt that it was going to taint their learning somehow or limit their ability to learn and to be able to be safe practitioners. It was sort of similar to the resistance that educators had when the calculators were introduced, and how they thought that they wouldn't be able to do math, they wouldn't be able to, even do simple division. But really, it's a tool that has really transformed the way we're approaching what people learn and how they use information. It's not about doing the routine rote calculations. It's about being able to bring the information together in a meaningful way and then using that, triangulate that information so that you can make the best decision possible. I also had a student early on ask me, well, if I have all these references in my mobile device, why do I need to study? And I thought, oh, that's a very good question. Well, the answer to that is that the situation changes because even if you have the information there in your hand, you need to be able to. It takes a human to be able to make sense of that information and determine whether it's relevant to that situation. So that's the other piece right here. Is that you want to use the technology to do the heavy lifting. Bring that information at the point of care, at the point of need, and then help that guide the professional or the student or the wannabe, the individual who's striving to become the practitioner, to use that to decide what's the best path to use for this patient in this situation. So I think that piece right there is, it's not about the information, it's about the application. And so driving this mobile technology initiative through the college has really helped support that notion and prepare our students for entering a very dynamic, technology-infused healthcare arena. So it's very exciting to be involved in that. Now, what's happened with that, of course, is initially we were providing these resources to the students, giving them the mobile device and showing them how to use it. But now things have changed. Our students are coming with multiple devices. They're very tech-savvy as far as how to use these devices. So we're adopting the philosophy of bring your own device. But then we still have to show people and our learners how to use these devices for decision support in a meaningful way in practice. So that's the one right there. So, and that translates across all levels of education, nursing education. The other is, again, it's about how do you build competencies. Again, you don't want to have, you have to remember that while certain information, about basic physiology and things like that, that information stays relatively the same. You can learn some new things, but other things that are changing is treatments and healthcare protocols and new things that we've learned about patient responses and how, even now we're looking that we don't treat women in heart disease the same way as we treat men, to learn all the nuances and all the research that's been out there that has informed what it is we can do to improve our patient outcomes. So what we really need to be able to do is to help number one, bring that research and evidence into our education, and so that we help the students make sense of this research and then be able to translate that into practice, and again, because the research is a moving target, it's ever evolving, there's always new things coming down the line. We don't want to have a 13-year delay before the information gets to the bedside to benefit the patient. So we need to have this obligation to help develop these skill sets among our students so that when they're ready to go into practice, they know the process. They don't have to memorize what it was when they were a student. They have to know how they can deal with this new information while they're a practitioner.
What are the gaps in the science that your specialty addresses?
The gaps are currently, we're learning more and more about, how individuals are using information, and then let's use the context of hospital system and the EMRs and health IT, and how sometimes it's not as well designed as possible. So people are working around, when you do the workarounds, then there's often negative impacts that occur. There could be some never events that you have occur. And so if you're thinking about how we access and use information, seeing how people are using, or maybe the systems are not working as effectively, how workarounds are being utilized to improve, to at least get the job done, but not necessarily improve the patient outcomes. So we have to look at those processes to identify where the gaps are in that. We also have to look at how we can use information more effectively to guide practice. So it's about, we've been very good at collecting information. It's about now the big challenge is the meaningful use of that information, how we can drive quality improvements and system improvements to improve patient outcomes. So that's one area right there. The other area that is from an education perspective, and that's an area that I'm also exploring, is how is it that we can get students to start thinking like a professional, a practitioner earlier on, and so to get into that habit of looking at what's available, what the information is, and then applying it and connecting the dots. Often what you see, especially when you're dealing with novice students, is they're tending to compartmentalize what they're learning from one course to another course. And even in that course, they compartmentalize what they're learning in the didactic lecture area to what they're learning in the clinical area. So there's often that gap between. So how can we more effectively, make that transition so they're making those connections not only beyond, that one course, connections within the course, but also to carry that through. One of the challenges that I had, as you recall, my background was community and public health. When I was teaching community health, the challenge that me and my colleagues experienced was helping the students make a connection between, what they had learned in all the med-surg courses and in pediatric course and maternal health course, and then see how that knowledge that they acquired there translated and made into connections into their that course there. Because in the community, it's everything. You really put all of that into practice, and you really are surprised how much you know. So the gaps are, to go back to the question that you had, now what are the gaps in that is, again, how can we help students learn and make these connections earlier on? Because what we really ultimately want to have accomplished is not really helping them memorize information so they can do behind NCLEX, and then even at a graduate level, have them memorize things. What we want them to become is competent thinkers. And I think thinking is that's the really important piece. One of the comments that I made earlier, one of the things that we want to develop is we want to develop thinkers, individuals who are able to critically evaluate information, not only but think on their feet. So that's the challenge right there, is how do you get someone to be a critical thinker? And that's critical thinking is something that we talk a lot about. And I think that one of the challenges for our educators and even the mentors that you find in practice, because you should be working, it's not about just learning and getting the degree and then going to work. It's an issue of lifelong learning, life-wide learning. So we're developing that skill set and passion for learning, hopefully, and then to get people to think. I'm reminded on Dr. Elizabeth Smythe, who is an educator, who had a very sentient quote that I really like to rely on frequently, and she made a comment about how we just can't help thinking. We always think. We're always thinking. Even while we're sitting in there in class, students sitting in class are thinking about buying shoes or what are they going to do later. So we're always thinking. We can't not help thinking. But the key is to have meaningful thinking, to focus thinking, and that's a challenge of educators, is to get the learners to think in a very focused manner, and that can be by listening and then asking the right question. So that's the challenge right there, is what are the right questions and how can we frame them so that instills that high-level problem-solving and critical thinking that we have for our students.
And how does this relate to state and national policy and priorities?
Oh, as far as, I think the national priorities are that nurses should, if you've read the IOM report and some of the other initiatives that are occurring, is that nurses are going to play a very pivotal role in improving the healthcare system within the United States, and there will be an impact. I think there's going to be an impact in other countries. I think other countries are also interested in doing that, and they're at a high level. There are some interactions and collaborations occurring, and all within nursing internationally as well as other professions internationally, to take a leadership role in driving improvement in healthcare. So from my perspective, the roles and the research that I've been doing, which is about decision support and at the point of care, at the point of need, as well as improving strategies to educate future practitioners, nurses, advanced role in my area of focus right now, is that we want to have the capability to understand how we can put our resources to best use. What's most effective? What's going to have the biggest impact in improving our product, which is our graduates' ability to perform effectively in a practice, no matter what setting they go into, no matter what challenges they may face, because, as I mentioned earlier, the healthcare arena is changing dramatically. How we will practice is going to change dramatically. We don't know where that is right now, or where it's going, but we do know that we need to be prepared to step up to the challenge.
What will be better in nursing and healthcare because of your science and leadership?
I believe truly that what would be better is improved quality of patient care, and health outcomes. I think that nurses have a key role in that, and nurses are very well respected. They're trusted by the public, and I think that if we are true to ourselves in ensuring that our graduates are well prepared to step into these roles, that we will perpetuate that, and we will be justified, and the public will be justified in having that high view, high profile, and high respect that we've been beneficiaries of for such a long time.
Do you see any changes to the local, state, or national policies to help support the final product of the graduate nurse or the bachelor nurse, to support them to make, reaching that goal of better patient care?
I think there is a change because I think the heightened awareness policy, of course, it has been legislated. The healthcare reform, has been instrumental in opening doors and opportunities for nurses to work in advanced roles. Nurse practitioners in particular are going to be assuming a major role in that, but there's a lot of opportunity for nurses who are advanced role nurses who have, are graduate prepared nurses working in clinical trials research, as clinical nurse leaders, as educators, as well as healthcare administrators, and also as innovators and entrepreneurs. So there's a lot of opportunity for the advanced practice nurse in the transforming healthcare arena. So the policies, and I think that what's really been helpful is the fact that there has been evidence showing that nurses have an impact. So Linda Akins is one of the seminal leaders in that area, where she's demonstrated that people tend to survive if they have nursing care. So, and then of course we have the anecdotal experiences that our healthcare policymakers have had themselves, because they have needed nursing care, and then they see what nursing care can offer them. So those things where we've actually put ourselves out there and actually demonstrated that we have a significant impact has really impacted policy changes and the direction that things are going.
What advice do you have for the next generation of nursing leaders?
Okay, I do have some advice for the next generation. I think number one is to be open to change, because again, as I've mentioned several times, is that it's a very dynamic healthcare environment, that we are entering. And you have to be open to change and willing to look at things, creatively, to look beyond your discipline. That's one of the things that I've always strived to do, and I think that that's one of the things that has really invigorated my practice, is to see what other disciplines are doing, be collaborative with other disciplines, because they have much to offer, and you can learn a lot from other disciplines and how they are approaching problems. And sometimes you can work together to solve a problem that we both share. So I think that collaboration is essential. I think that often what happens with that is that not only do you have new approaches, you may also have, as I said, new solutions, but there may even be some innovation that could be sparked by that kind of, reaching beyond your silo. So I think that's important. I also think that it's important, and I know that people value technology. I think it's important to embrace technology, but I think we need to be careful not to forget the human. I think that it's not technology for technology's sake. It's not technology to give it more power than we have, because I think the human component of it is absolutely essential. So that's what really should be focused on. Use the technology to do the heavy lifting, to help support what the human is going to be doing. Then the other piece that I would like to share is that it's really important to communicate. Communication is essential. Part of communication, effective communication, of course, is listening, hearing what are the issues, not only about among your colleagues, profession, paying attention to what's going on in the media, observe, what are the trends, what are the patterns that are happening, and see how that fits in there, in how healthcare or you as an individual practitioner can use that to help guide what you're going to be doing next. And then the last thing, of course, is it's about relationships. So it's about building bridges, working with collaboratively, and being open with other disciplines, individuals. And I think relationships are essential for a positive and very exciting future in healthcare.